Hi, everybody. I wanted to just talk to you a little bit about the sleep hygiene for babies. And this is important information from the American Academy of Pediatrics. And one of the things that they recommend that it's very, very, very important to them is that parents not sleep with their babies in bed with them. This is the language they use. It's very strong language. They understand the respect that many parents choose to routinely bed share with their babies. The guidelines read, however, based on the evidence, we are unable to recommend bed sharing under any circumstance. That's a really strong language. And I think I agree with them. The evidence is clear that it significantly raises the risk of death and injury to a child to sleep and bed share with a baby. And while the AP recommends babies should also sleep in the same parent's room. In other words, they should be in the room with the parent for the first year of life. The minimum recommendation is 6 months, but they should be in their own crib and in the room with the parents so the parents can monitor them and make sure they're okay. Also, do not rest with your baby on soft surfaces like sofas and cushions and armchairs in which you might go to sleep and accidentally suffocate your child. Babies need to be on their backs also when they're sleeping on a flat surface, bare of any extra decorations or blankets. It is recommended that weighted blankets, weighted sleepers, weighted swaddles, or weighted objects not be put near or in close to a sleeping infant. Actually, they recommend the baby have a little kind of a blanket jumper or something like that that's already built into their clothing. That would be better. Also, the baby should not wear any hats of any sort while they're sleeping. Remove the hats because they can overheat. There should be no crib bumpers or stuffed toys or extra blankets or pillows placed in the crib with that baby. Now, in May of 2022, the Safe Sleep Babies Act was enacted in an effort to prohibit the sale of incliners. Incline beds more than 10 degrees are prohibited, and so they can cause death to children. Also, in that same sort of thinking, a baby that goes to sleep in an incline like a swinging chair or a swinging a sleeper of some sort should also be removed as soon as they go to sleep to outside on a flat surface, because when they sleep, if they're in an incline in any way, they can their chin can go down and cut off their airway, and they can be killed by that. So car seats as well. Same thing happens with car seats, infant slings, other sorts of things like that. And last of all, they highly recommend breastfeeding if you can. It reduces the risk of SIDS significantly. So thank you very much.